I'm joined today with Dr. Jesse Spiegel, who is a acquaintance, friend, and colleague, and I love referring to you. I want to tell people a little bit about you first before we talk, and then I'll let you fill in the blanks. But you're a licensed psychologist. You practice in Los Angeles. We have met in person, and that feels like weeks ago, but now I'm realizing it's probably almost a year ago, which is wild. So we've talked a little bit about what you do, but you really specialize in OCD, anxiety for adults, adolescents, and children, which is unique. Treat people with depression, insomnia, as well as some other things. Today, we're going to be talking about health anxiety specifically because how it overlaps with what we do. But one thing I didn't know about you is that you're a clinical instructor at UCLA as well, which is fascinating.
Yes. So that last piece, I work with third year psychiatry residents, third or fourth year psychiatry residents, or they have a CBT clinical rotation,
Great.
and I supervise them on their CBT cases. It's a lot of
Yes.
fun. It's a fun experience being in a supervisory role like that.
Yeah, absolutely. How did you get into psychology specifically? What drew you to it?
Um, so my mom is a psychologist, and actually my oldest brother's a psychologist too, but with my mom there was some familiarity. I would say though that wasn't necessarily the path that I saw myself going into. I was really into politics and international relations, and I studied government and politics at the University of Maryland and interned for a few different Congress people while in DC. And then I worked as a paralegal at a law firm, and that was when I very much discovered that I didn't want to go into law. So there was a little bit of discovery afterwards. I went to Israel, and then anyway, I came back and I was figuring out which path I would go, and I really like the idea of working with people, being able to make a difference in their lives, and long path. Definitely didn't start as an undergrad in psychology, but made up some coursework, did a doctorate in clinical psychology, which meant then I didn't finish until I was about 33 years old. But here I am, became a
All right.
psychologist, and then I eventually specialized in anxiety disorders and everything that you mentioned beforehand, OCD, insomnia.
Yeah. Yeah, wonderful. And yeah, I'm glad that you ended up where you ended up because I know you're helping so many of our patients, but just people in general. So really appreciate that. Like I said, I wanted to talk about health anxiety. So can we just give an overview of what is health anxiety before we dive in?
Sure. Health anxiety is, I would say it's broken up primarily into two pieces, illness anxiety disorder and somatic symptom disorder. And what illness anxiety disorder used to be referred to as hypochondriasis, and illness anxiety disorder is essentially an excessive preoccupation with one's health and the possibility that you might have a disease. And people with illness anxiety disorder will go to great lengths. And again, I may be using illness anxiety disorder and health anxiety interchangeably, but they'll be going to great lengths to find out if they have the disease, to do anything they can to prevent it from getting worse. And this will lead to a lot of reassurance seeking, a lot of Google researching, WebMD, you name it, they've pretty much scoured the web. A lot of doctor shopping, a lot of reassurance with doctors as well. Um, so a medical provider may find that they have many visits, many phone calls as well from people who suffer from this type of condition.
Yeah, and I think it's so important if you're like for practitioners to know this piece too, because we don't talk about it a lot in school, but these are the patients that are coming in and they've seen or are actively seeing many other practitioners, right? Like they're seeing the acupuncturist, the chiropractor, the neurologist, their GP. Like they have a list of people. Would you say that's pretty common for somebody with one of these
A
disorders?
very big list. Yep. A very big list where they frequently will reach out to them. It's not usually just one visit, one regular checkup. It's constant.
Constant messaging. And as a provider, it can put a lot of, stress on the provider with just like how much they're reaching out as well. And I feel like sometimes we're not catching it and we're saying, oh, they need a lot as this patient, or it can be, just stressful in the practice. But identifying that piece, I think, is so important to get them the help that they actually need versus like the help that they're reaching out for.
Yeah, and where it can be challenging is because sometimes there are some cases where diagnosis is not clear for the provider, for I could imagine for the medical provider, and it's just not clear. Sometimes it takes some more time with formulation. This though just really will present as an endless sense of reassurance where you could provide all the information, they could gather the information, and it's never enough. In a sense, it can function as a band-aid that just keeps ripping again and again.
Right, right, right. So you're saying when you're telling somebody we do have a diagnosis, this is the answer, and they're still asking questions. Is that what you mean?
They're still asking questions. And I would say, in addition, people with health anxiety are always going to fear that something dramatically and catastrophically worse. So even if they did have something, it's still going to present, they will still think it's much more severe and that there's something that's yet to be uncovered.
Right. Okay. So something where it could be, you have irritable bowel syndrome, you've got some constipation, and the thought of like, I definitely have stage 4 colon cancer, despite a normal colonoscopy, despite a normal sigmoidoscopy, or what have it.
Exactly.
Yeah.
Exactly.
And how do we differentiate health anxiety from generalized anxiety?
Sure. Generalized anxiety is something where there's health issues may be a source of anxiety. However, I would say it does not at all reach the level of someone with, a health anxiety and illness anxiety disorder. And in addition, someone with generalized anxiety disorder, they may have just more general life worries as well. Uh, over work, stress, relationships, and health may be a component of it, but it's really by no means the predominant one, and it is not at all at the severity that you'd see with the health anxiety disorder.
Okay, and with health anxiety disorder, is it typically focused around one specific condition that the person is obsessing about, or will it kind of be like whack-a-mole, where like maybe one thing transforms to another, or is there like a more typical presentation?
Anecdotally, I'd say it usually goes to various medical issues. It's not just around one underlying theme. I there are sometimes some cases where people really just think they've had, some unfounded brain tumor, and they will go to great lengths for years, nonstop visits, and they're stuck on the brain tumor. I'd say more frequently it is really going to be going to different themes. Someone where they have a mole and they suddenly think it's stage 4 skin cancer. But then they were also walking and their ear happened to brush by and hit a leaf. And now they're convinced that a bug got into their ear and it's going to do incredible nerve damage and so forth. And this is going to be irreversible. And it just goes from theme to theme to theme, although related to health related issues and very catastrophic ones too.
Okay, so can jump around, can be just one fixation as well.
Yeah.
And you mentioned two things when we first started talking. You mentioned the illness disorder, and then you mentioned, what was it, somatic
Symptom disorder, yeah.
symptom disorder. Can you tell me a little bit about that one?
That one, someone will have in somatic symptom disorder, someone will have some symptoms. For instance, some medical related symptoms. It won't be like that there's none present, which is the case for illness anxiety disorder. But in somatic symptom disorder, they may have some medical symptoms. However, they're fairly mild and often to the extent that the person is concerned over the catastrophic outcome, they're nowhere nearly to that proportion.
Got it. Got it. So with the health anxiety disorder, you said they're not presenting with any actual symptoms?
So yeah, and I know I keep using it. The term is illness anxiety disorder. I just for all intents and
Yeah.
purposes calling it health anxiety, which I think really you can say for as the umbrella for both of them.
Okay.
Illness anxiety disorder, they will not have any symptoms, but there's always the fear that they may have something versus
Okay.
the there's a mild version of it.
Okay, so
Mild.
they're not coming in with a headache and worried about a brain tumor. They're coming in with nothing but are worried about a brain tumor.
Now,
For
you could, for instance, have a headache. I mean, if someone keeps thinking of that they have an issue, they may experience somatic like symptoms, where it could still technically fall under the illness anxiety disorder. I would say almost in distinguishing between the two, you can get caught in the weeds. It's just constant debilitation and way, way, way more than what they're actually experiencing, if at all.
yeah, yeah,
When someone has panic attacks, they'll experience physiological symptoms. I mean, again and again, when you have anxiety, you can experience it in your body. Then that's a very, very common versus it just being stuck on unpleasant thoughts.
yeah. And it's not uncommon for us to see gradations of this in functional medicine or like people looking for alternative medicine because I think that what ends up happening is they're seeking conventional doctors who aren't willing to do extra tests. And functional medicine is known for doing more testing and looking into things and finding the root cause, which is well intentioned. And yet, I think that we need to start to be a little bit or a lot more objective about the testing. Can you talk about how over testing someone could actually potentially worsen some of these conditions?
Yeah, so it's quite the difficult experience that you have because often I would say a naturopathic doctor can find something that a physician doesn't find and may have an explanation that actually really can lead to symptom improvement and overall significantly help for the patient. And then by the same time, you're going to have to manage patients where they're constantly seeking an answer and there has been clear information presented, but they're just going and seeking again and again more and more information. How I would distinguish it. So if you think about it for something like illness anxiety disorder, often if someone has a cut on their hand and they're bleeding, you get a Band-Aid, you put soap, you antibiotic, and then you put a Band-Aid, and it allows the arm, the wound to heal. I'm trying to give a very simplistic explanation here. And then I'd say the challenge of something like this with illness anxiety disorder is you give the reassurance, the person can look up something online. It presents this maybe short term, very, very short term relief with their anxiety. However, suddenly another doubt tricks in. Well, maybe they missed something, or maybe this wasn't the right test, or maybe they don't have the right information, right the kind of test. Or maybe there's a better type of test, or maybe I should have looked up somewhere else, or maybe I didn't do the best job at explaining it. And the reality is, this is why some of these behaviors, which can function as compulsions, they're never enough. So unlike that example I said of, you provide a Band-Aid and it allows the wound to heal, this provides short-term relief at best, but in the long term, the person suffers and they're really completely unable to manage the uncertainty that they don't have an answer for their medical condition. And ultimately, I'd say what is best is the person learns to manage um, how to handle the uncertainty. There
Yeah.
could always be some further tests, and medicine is always improving. And it could be the kind of thing some maybe 20 years from now there could have been some underlying medical explanation. However, we can't answer that. We work with what we have currently.
Yeah. Managing uncertainty, how much of what you do is around that with patients?
Everything.
Yeah.
Ultimately, it's everything. So in my work, we'll do a lot of work with like health anxiety on exposures. So the big thing is exposure response prevention is with the treatment, where they will have various exposures where they'll have to go in direct contact with their fear. And then the response prevention pieces, and now they're not allowed to do the behaviors, the compulsions that would have provided the short-term relief. And the idea is the longer they stay in this distressing experience, the more they're able to tolerate the symptoms and learn, as well, that even if the symptoms don't get lower and so forth, the distress, that they can handle the uncertainty around it. But ultimately, yeah, it's about really managing uncertainty. Perhaps, for instance, as that person was walking, some bug did get in his ear and it could cause some horrible infection that, he's not going to discover until 10 years from now, in which his family has developed. Again, I would say the statistical likelihood is beyond limited. However, kind of that cognitive experience of just explaining it to them in statistics is not enough, and they need to really come into these experiences and distress through the use of exposures. But uncertainty is the absolute hallmark for getting better and being able to accept uncertainty. We can't have all the answers.
Yeah, yeah. I want to give a case example of like a common kind of presentation that we'll see, and I've seen this hundreds of times. So it's not a person, it's just like a general kind of archetype. But like somebody comes in, they have diarrhea and bloating. We rule out, they don't have a parasite, they don't have an infection, they have abdominal pain. They have irritable bowel syndrome. So they fit that diagnosis. They've even had a colonoscopy in the past. It was normal, yada, yada, yada. So our workup is done. And then we're treating somebody for irritable bowel syndrome, and they come back, the next visit, and they say, I really want this other parasite test. It's a 4-day test, and like we might have missed something, kind of thing. Or they come back and they say, can we check this marker of my thyroid as well, because I heard that hyperthyroidism can contribute to diarrhea, but we've already done general blood work that didn't show that. um, and and then they go, okay, yeah, I want to treat the IBS, and you kind of get them there and they're ready to treat it. And then 2 visits later, they're coming back and they're saying, I found this colostrum product. Do you think this would be helpful for me? And what I'm trying to paint the picture of is this kind of like they're half into the diagnosis, but then they go on another kind of rabbit hole dive of Dr. Google of, could it be this? Could it be this? Am I missing something? When they're in that mindset of still looking for something else, or like the magic bullet, how can that actually affect their healing process in general? Because we really see that those people typically aren't getting better at the rates that other people potentially could be better.
The answer is it's not helping them is the bottom line. Where I would hear is there's probably a lot of researching, reassurance seeking, and it's just not enough. And the goal would be to help with the patient, I'd say, in setting limits to the amount they're doing this. Right? I think the challenge that you would have as a provider is, well, you could control it in your setting, but they may be doing some of that on their own,
Mm-hmm.
uh, their home, and they may be reaching out to other providers. And this is where you kind of need clear collaborative care among all providers, all different medical providers, if there's a mental health provider involved, and trying to help set limits, and not also shaming the patient too. The patient isn't doing this because they're malingering, or that they're, trying to just get in your head as a provider. Uh, they're doing this because they feel the urge to. This feels very catastrophic. If I don't figure this out, I'm going to constantly have medical issues. Maybe I won't live. Maybe this will impact my ability to be there for my family and so forth. And, it's very challenging for them. Um, and so you really don't want to shame them, and you can acknowledge the distress that this causes them, while also saying, I don't think getting another test will be helpful for you overall, and will provide you with any new information, and really trying to set more clearer limits.
Yeah, yeah, yeah. And we see that, and that's how we talk to people about this too, but we also actually see it's not only not helping them, but it tends to make things worse because it feels like it's adding like fuel to the fire of the anxiety piece. And we call it like hypervigilance, but like the hypervigilance goes through the ceiling, and now they're like, oh, and now I feel this, and now I feel this. But we usually see it contributing more to the anxiety, which then contributes more to the seeking and the searching and the reassurance. And then it just becomes this feed forward cycle.
Yeah, and there's often a sense of urgency. I need the answer right now. I mean, it's a real challenge with phones too, is you can constantly have some type of information where versus just learning to manage over time. And but I'd say, for instance, before cell phones, where people they would experience some distress, it'd be overwhelming, and they'd have to learn to wait and so forth. And then actually, usually the issue would be less pressing over time because other things came up. So it's really where phones can be problematic.
And social media obviously makes things even more heightened. What effect do you think that social media in general has on people with these conditions right now?
I'd say if you have these conditions, it's probably best to not use social media or really, really restrict your use or what you're looking up. Um, it to some extent, you could say social media has the opportunity to provide people with a sense of community. The challenge, though, is people will try to seek out answers and seek others who maybe have what they're explaining. The problem is they are not, influencers and so forth. They're not experts. They are very good and very effective at marketing and getting their name out, but just because someone has a YouTube channel where they're explaining some medical issue that they had, maybe accurately or not, it doesn't mean that one of the viewers should be seeking that out for confirmation of a disease and so forth. And I'd say the problem is it ends up even feeding into one another. During the pandemic, obviously, I'd say from a medical standpoint, a lot of people were very fearful of getting COVID and so forth. And I will also tell you there was a high degree, actually, I saw on a few different cases where people were suddenly, among some of my pediatric population, where someone was developing an acute out of nowhere uh, severe form of Tourette's, where they were having, significant verbal tics, motor tics that were so severe, and it was not following the natural course of how someone gets Tourette's disorder. It does not really present as acute, and the reality was it was actually it was more connected to functional movement disorder, or where you could see more things like conversion disorder. But people where this came about, for in particular for this population, teenagers, pre-adolescents, where they were watching a lot of TikTok videos,
Mm.
and this took on a fervor where people started imitating the symptoms that they had, that these people in these videos. And um, again, I see social media as just being very, very problematic for anxiety disorders as a whole.
So are you saying that the person with an anxiety disorder was watching TikToks of people who had Tourette's and started to almost feel like they were experiencing it themselves, and it started to like almost self-manifest?
Yeah, exactly. Now, this person did have some tics prior to meeting with me, but they did not have anything to the severity of what I'd seen, and it was a completely different course. Now, at the same time, if I told this person it's all in your head, they wouldn't have suddenly said, "Oh my God, you're right, I feel totally better." It really, at that point, was more and more challenging for them, and it would really actually they would lead to them engaging in these tics and so forth that were fairly debilitating, very debilitating to them.
Yeah. How much of health anxiety is there an overlap with OCD at all? Because I'm kind of hearing like these these things that feel like similarities where like compulsions maybe have been playing a role in that, but also just like the obsessive nature and like the stickiness of it.
Yes, I'm glad that you asked that. The reality is actually among the community and people who treat OCD, health anxiety is often there's a lot of difficulty in distinguishing the two. So I know the DSM provides a different diagnosis. Where I would say is so the treatment off is actually pretty much the exact same for both OCD and for health anxiety. Where you would see some differences where it'd be a little bit clear, oh, this is OCD, is if it's not just on health related themes. So if someone has concerns of harm issues, specifically that what if I were to harm someone, I don't want to do this. And I'm talking about people where they're the last one who would engage in harm, but they
Hmm.
get, very triggered by it. In that case, if they also had health related issues too, health anxiety, that would be, more clearly like as an overlap, this is OCD versus someone who just has you know, significant health concerns, where in those cases you'd give a different diagnosis more to like a health anxiety.
Right. Okay, that makes sense then. And why does and can you talk a little bit more about like what exposure therapy would look like for someone that maybe the example that I gave where it's somebody that is wanting to do all of the tests and take all of the supplements kind of thing. What does exposure therapy actually look like and why is it helpful for people?
Yeah. So what I would want to look at as far as like if I were to provide treatment for that patient, I would first want to identify what are you doing to attempt to either eliminate the reality, eliminate your concerns that you may have this type of gastro problem, or just answer the question yes or no. So we'll come up with a massive list of what they're doing. If they're researching all the time, if whenever someone mentions anything around gut issues, they touch their stomach, they try to check for some type of change, the amount they're calling their providers. If the providers do provide them with an answer, how they then try to respond for additional information. It maybe even be subtle ways that they're trying to get reassurance by looking at their provider. If the provider is not looking at them, this means that they're not telling them the truth. They're all trying to answer yes or no. I may have this condition. So first we want to really identify that, because that's what's maintaining the distress. And then I'd say from there, it's about breaking those rules, doing them differently, doing the opposite, and within it, doing exposures too. So, perhaps it's, writing a script of their worst fears coming true. And again, they're not allowed to engage in any compulsions, and they have to read it again and again and again and again. Perhaps it's
So
about
an
reading them.
example of that, like with our example, would be like, I end up getting stage 4 colon cancer. So like reading that kind of story out loud, even.
Reading that story out loud, and you want to have it so it's like at a present moment. So because normally their head would go and jump from scene to scene to scene, but we want to think of what is the worst possible experience that could happen. And so imagine it's that they're in their last week of their life, their friends are visiting, and everyone is crying, and you would really want to bring to life that worst feared experience. And they would have to read it again and again and again and again. um, we could put pictures up to add to that sense of sadness, but really try to make it so it is as real as possible for them. And the idea behind it is two pieces. One can be that the longer you stay in a feared situation, your anxiety will habituate, it will decrease. But even let's say in some cases where it doesn't, you learn that you can manage to have an uncomfortable experience and that you can handle it. And that's ultimately what I'm my ultimate goal is for treatment when related to uncertainty, is that a person can learn that they can experience a distressing thought, they can experience a distressing experience, maybe even some gut related issue, but it doesn't require their immediate attention. They can handle the uncertainty and that they'll be okay. And I want to say through that, my goal is not for, any patients who I work with, for them to stop seeing their medical providers.
Right,
It's
totally.
just more what is reasonable.
Yeah, yeah. And that was going to be my next question is, it feels like there's a fine line here between we don't want to just ditch healthcare and say, okay, I'm never going to get a colonoscopy again, right? Like you want to stay up to date with your normal screening exams and go to a doctor if something is really wrong. I think that's a piece that becomes difficult, especially in extreme cases with people with these disorders where it's like, what is the line of when do I actually see my doctor versus when do I practice exposure therapy?
Yeah, and this could be something that could be discussed with, so if I, can you still hear me? It seems like my
I can hear
Zoom.
you.
Okay, I was apparently getting another call. Sorry about that. But it seems what I would say as far as what I would want to coordinate is again with the medical provider, with you, with me as the psychologist, and then as well with the patient is figuring out what is an appropriate amount of times for visits. Let's say though, we'd want it to be what is with a standard population and so forth, that doesn't have as much health anxiety. But let's say they need a little bit more appointments. They're still trying to find a balance where they're not going to get all the information that they need. And the idea is, let's say if they're reaching out 10 times in 3 days for information, then it would be about reducing that amount. So I don't think they would be able to just, have a visit once a year, but how can you reduce it so it's a more reasonable amount?
Yeah, yeah. So almost like a taper plan. Like let's move to, once a month or once every few months kind of thing first. Yeah, that makes sense. And so it sounds like a lot of the treatment, I know it's probably more than this, but a lot of it is like sitting with the uncertainty. So getting people comfortable with not knowing everything, as well as being uncomfortable in a state of like sadness and fear and anxiety, just like sitting with the emotions that are present as well.
That's spot on. That's exactly right.
Anything else in terms of the buckets that you use for treatment with CBT or DBT or ACT that are important with these individuals?
Yeah, and you mentioned another thing that I would say is you mentioned ACT, ACT, acceptance commitment therapy, and there's some real benefits from this treatment. There's a lot of work with values and goals. So one thing that I would find that could be quite helpful is you know helping the patient understand, like, what do you want out of life? Do you want a relationship? What are your values? Do you want a good relationship with your husband, with your wife, to be a parent, to travel and so forth. And in thinking about that, when you then look at how they're responding to their health anxiety, is that getting you, with the amount of behaviors you're doing, is that getting you closer to your overall values? Now, they may say, well, this medical issue needs my immediate attention. I can't even get to my values because I have this underlying medical issue. And then I would look at it from them from a longer term perspective. Well, this has been something that's impacted you for a while, and it seems like you're putting your life on hold. How can we get you to reduce them out? You may not have the answers you want, and at the same time, you're going to be able, though, to live a life that is more meaningful to you.
Yeah, yeah, that's really powerful. I've dealt with anxiety and health anxiety in my personal experience, what I've talked to you about a little bit, but one of the things that I found helpful for myself was distraction. Is that a recommended treatment or is that a non-effective coping mechanism?
Uh, the reality I'd say is all of us do it to some extent, if we're being honest here. Uh, Overall, it's not helpful because you're not learning to tolerate the emotion, the anxiety, and so forth. So what I would say is if this is something that you're regularly doing, or if one is regularly doing, that whenever they get distressing information, or if they start to feel stomachs with something with their stomach, they immediately look at their phone, or they immediately try to distract themselves with something else. They turn on the TV. Well, then I want to be aware of that because they're not learning to tolerate the emotional experience or physiological symptoms or even just the distressing thoughts. And in which case, I would say I definitely would want to look at it. Now, where I'd want to keep it in mind is, let's say if someone had a significant medical procedure that they had to do, and this is not something that's going to be regularly occurring, but it's kind of like a one-off experience. And there, if they need some distraction, sounds like that could be quite helpful. But this is not something that is going to be part of their everyday experience. So if you need a little bit of distraction and to move forward, I don't see any problem in it because it's not going to lead to a long-term impairment.
Yeah, that makes sense. So I think the big part you're getting to is like we have to learn how to tolerate the uncomfortableness and the uncertainty. Like that has to be a skill that starts to develop in order for long-term progress to actually take place, which makes total sense. And that's really helpful. And I think also what maybe I was saying more so too is I would find like there would be times in my life that I would almost be like bored in life. And if I it just got busier, then all of the like obsessiveness would kind of calm down a little bit. I don't know if you have any thoughts on that, but it
If
was like
you, so I just
becoming
want to make
more
sure.
passionate about something, like to be like, oh, one of the times was like I was transitioning careers. And once I transitioned, like all of the obsessive kind of thoughts kind of went away for a long time. And so I don't know if that's a common pattern at all, but it was like I needed to be invested almost more in something.
Sure, and that makes sense too, is where you want to have structure and things that are giving you meaning. And if you're, often a lot of smart people, they have a lot of anxiety and their mind can go to different themes and so forth, and concerns and catastrophes that could happen. And the mind is active, where if you don't have structure, that could lead to that as well, in which case then just giving yourself a sense of structure, a sense of purpose, doing things that are of meaning, your mind is going to be able to maximize itself in a productive way, but that's not related to unnecessary, unrelated anxiety.
Yeah, that makes sense. I want to be cognizant of the time. If somebody is listening and they resonate with some of the things that you're talking about here. One question first, too. It's like, this is a spectrum, right? So is that correct in terms of there could be people that maybe don't even meet the diagnosis, but have mild forms of health anxiety?
Sure, absolutely. Yeah, just because someone doesn't meet the diagnosis of illness, anxiety disorder doesn't mean that they aren't having some struggles as well, where they're finding themselves stuck. I would want to look at are you finding yourself stuck because of your anxiety, and where it's hard to kind of move forward? And then, then it may be helpful to talk to a specialist.
Yeah. And if people want to learn more about you and what you do, where can they find you? And any last words for somebody who may be listening to this and resonates with it?
Yeah, so my website is pretty straightforward. It's drjessespiegel.com, DR, and then my first name and last name. There's no I for my name, Jesse, just Jesse. Uh, you know, what I would say, a lot of times when people come and see me, there's a concern that they may be this one-off and with all their struggles. And there are a lot of people, I mean, who struggle with the uncertainty over health issues, or if it's contamination issues, whatever it may be. And you know, you're able to get better over time. The work can be quite challenging, where learning to kind of embrace uncertainty and do things that are consistent with that. However, one can really make a lot of progress. And and I would even say, like, the people who I work with, I find to be very, very brave in the challenges that they take on, and it's really incredible to watch.
Yeah, that's inspiring. Thank you for that. And thank you for today. Thanks for all of your information and your wealth of knowledge. And thank you for always responding to my text questions that I send you.
I always love working with you.
Awesome. And I hope you have a great day too.
Thank you. Thanks so much.